Most people have heard of or even know someone who's had Alzheimer's disease. An estimated 5.2 million people in the US alone have this disease, with about 500,000 Americans dying every year from it. Niemann-Pick disease, on the other hand, affects only about 2,000 people, and that's worldwide. And while Alzheimer's disease is typically associated with the elderly, Niemann-Pick disease starts at birth. So what brings these two diseases that affect two very different populations together? Lysosomes. Lysosomes are essentially the digestive system of our cells. They take big molecules that our cells can't use, like proteins and fats, and they gradually break them down into smaller usable parts. But what happens when our lysosomes aren't working? Well, the same thing that happens when our digestive systems don't work. We get sick. Imagine eating a big Thanksgiving dinner. The more you eat, the fuller you get. If you eat too much, you'll feel sick and your body will take a while to digest everything, but it'll do the job eventually. Normally the same thing would apply to lysosomes, but in people with Niemann-Pick disease, their lysosomes lack the tools necessary to break down a certain fat. This fat's going to build up and it's going to cause a whole slew of problems, including an enlarged liver or spleen, deterioration of the nervous system, and a life expectancy that ends before adulthood. Because of the decline in mental facilities, Niemann-Pick disease and Alzheimer's disease are considered neurodegenerative diseases. Alzheimer's disease, like Niemann-Pick disease, also is associated with some degree of lysosomal dysfunction. So because of this, my research is focused on treating these diseases, not just at the level of the brain or the symptoms, but at a deeper level, at the level of lysosomal dysfunction. The trick was finding a molecule that was able to reverse some of these problems. Enter vitamin E. Now, this whole time I've been talking about lysosomal problems associated with diseases, but a wide class of drugs can actually cause similar problems. The main difference is that when you take away the drug, the side effects tend to go away as well. Well, some researchers found that vitamin E was actually able to reverse these drug-induced side effects without taking away the drug. So if we can do this with drugs, why not the neurodegenerative diseases? This is the question that we asked ourselves, and it's the basis of my research, in looking into how vitamin E could be able to reverse these disease conditions. It actually can. How it's able to do this, and how the lessons that we take from these experiments can be used to develop a completely new therapeutic treatment for neurodegenerative diseases.